That is my reminder to record. You'll be able to find the recording on the MCOH website following the presentation. At the end of the presentation, I am going to put a survey link in the chat box. This link will also be sent out in an email following the webinar. We really appreciate you taking the time to complete the survey. Your feedback helps us continue to provide webinars and trainings that are beneficial to you. So with that, I'm going to turn it over to Missouri Medicaid Audit and Compliance Director Dale Carr.
Thank you, Jessica, and thank you for the inviting me to the coalition to invite me to join you for this lunch meeting today. I am Dale Carr. I'm the Director of Missouri Medicaid Audit and Compliance, so working out of Jefferson City. As you can probably tell by looking behind me, we're very excited because earlier this week we moved from the Jefferson building in Jefferson City, which was about a block from the Capitol. We've moved over to the other side of town. We're closer to the HealthNet building over here off of Missouri Way, and it's a single level building with lots of parking around it. And they went above and beyond making this new and fresh working space for us. So we're very excited about that. We started moving on Monday and did it Tuesday and Wednesday, and so I'm here. My computer's here and up and running, but I haven't unpacked a single box yet. So, but we're very excited about that. 3418 Knipp Drive is where we're at right now. So that's kind of the big thing there. So let me just kind of go into a couple general things. I know that one of the biggest things that everybody wants to kind of know about or talk about would be the audits, and I am definitely going to get to that just so that everybody understands what to expect in that area. But I think it's also an opportunity to give you some good overall general information. So I'm going to kind of go through that a little bit too. And again, happy to entertain any questions there before we finish up today. So during this past legislative session, MMAC was actually authorized 10 new full-time staff, which brought our total state staff from 81 up to 91. So it doesn't sound like a big number to some people, but when you only have 80 and you get 10 more, that is better than a 10% increase, and it definitely increases our bandwidth to do what we need to do. Out of that 10 new positions, we basically allotted 5 new auditors for our provider review unit. And then we added 4 people to our provider enrollment staff, and we added 1 additional non-commissioned investigator. After COVID there, in I want to say it was about March of 21, Governor Parson directed that all state employees return to the office. And I'm actually kind of proud to say that since that time that MMAC continues to all of our staff work out of the office. We don't have any staff working remotely. So I think that we do that. There's a couple of reasons why we do that, but I think that having everybody here and available for not only us but for you is better customer service. So those are kind of some general things. Overall enrollment. So Missouri Medicaid Audit and Compliance, we do a number of things. We enroll providers, we audit them, we investigate them when there's fraud, waste, and abuse, and we also are basically the only agency within Department of Social Services that can impose administrative sanctions anywhere from education, recoupment of Medicaid claims up through suspending Medicaid participation or payments, all the way up to terminating a provider. As of the beginning of this month, we just went over 73,000 enrolled HealthNet providers. We're actually at 73,060 as of today. we enroll 65 different provider types. And then obviously there are a number of specialties within most of those provider types. If we look back over the last 6 or 7 years, we have added roughly 3,000 new providers per year. So I want to say 6, 7 years ago, we were down around 54,000. And again, today we're at 73. And a year from now, I would suspect that we'll easily be over 76,000. One of the reasons that we're continuing to increase the number of MoHealthNet providers is that MoHealthNet is adding additional provider types. So right now, as of the 1st of November, we're enrolling physical therapy, occupational therapy, and speech language therapy assistants, which we didn't previously do. We're also enrolling registered behavior technicians, which they work with behavior analysts in that provider area. I know that MoHealthNet is also looking at adding and enrolling community health workers and doulas, which are like midwives. It's an area that a lot of health plans are moving towards. So, in addition to adding all those new providers, there is a federal requirement by CMS that all providers have to revalidate at least every 5 years. And so we started doing that around 2018. And so in 2023, a lot of providers actually revalidated for the second time. And then as we're moving into 24 and 25, more people will be coming up for their 5-year revalidation, and the regulation states at least every 5 years. So some providers we are reducing that time frame down to like 3 years or 4 years, but the only people we're doing that for are those that don't have to pay an application fee, which is typically individual providers. And the reason we do that is with 73,000 providers, that means that we have to revalidate about 14,000 providers per year. So I'd like to level that out, so we're not having, we're only having 10,000 one year and 25,000 the next or something like that. So that's kind of what we're doing right there. Specific to dentists, because I know you're all interested in that. So I actually went back and pulled up some numbers this morning. So in 2015, we had 729 dentists or dental offices enrolled with MoHealthNet. A year later, in 2016, we had added 99. We're up to 828. In 2017, we added 78 more. We were up to 906. In 2018, we actually dropped down by 46. We were down to 862. And I primarily attribute that's when we started revalidation. So I think we had some enrolled providers that weren't active. Maybe they were a performing provider or a performing dentist for a medical office, but they had maybe retired or they just weren't active, or they didn't want to revalidate or whatever. In 2019, we started upwards again. We added 54. 2021, we were at 912. So 2022, Jessica, I think that's really when we started to put a push on adding, MoHealthNet raising the rates and adding some more dentists to the rolls. And so in 2022, we had 972. So that was an increase of 60 dental providers over the year. And then this year, for the first 10 months of the year, we've added an additional 24. As of today, we have 996 enrolled dental providers in the Missouri Medicaid program. I checked with my enrollment team earlier this morning. They advised me that we have about 13 applications in process. We were talking about, I mentioned the 5-year revalidation. So they told me that there are 20 pending revalidations. That means that they sent letters out on October the 31st to 20 providers, advising them that they were coming due for revalidation. So we obviously like to get that going as smoothly as possible, get folks revalidated before their due date, and then reset you for another 5 years. So if there's any questions with regarding to that whole revalidation process or whatever, my team be happy to handle those. Our provider enrollment unit is very busy all the time. I mentioned, like, say, 3,000 per year. During that last state fiscal year, we enrolled 3,140 new providers. We actually approved about 9,800 revalidations. We processed about 15,600 enrollment updates. So that could be anything from as simple as, we changed our phone number, we changed our email address, up to the far end of the scheme, or the far end of the process, where we had a complete change of ownership or something along that line, and it's a more complicated process. We merged, or we did some other type of change of ownership. And we also handled about 58,000 email inquiries from all different types of providers. So, again, talked about the last legislative session. During the last session, we received approval from the legislature for funding for us to implement a new 100% electronic provider portal. Excuse me. And we're really, really excited about that. It's going to greatly improve the speed and efficiency of the provider enrollment processes. This new portal will have very robust self-service features. It's going to have a dedicated provider assistance call center. So there'll be FAQs. There'll be a chat bot there, obviously, but you'll be able to get a hold of a real person if you need to at any time. And if it's not something that the call taker can handle, then it'll go through a process of being upgraded to another tier until we get the issue resolved. It's very comprehensive, and so it's going to take us about 18 months to fully implement that whole new provider enrollment solution. So we're expected to go operational sometime during the summer of 2025. We're down to 2 vendors. We're going to make a final selection, and then we have to get the final approvals and get the project kicked off. But I'm very hopeful to have that project up and kicked off by the end of the first quarter of this coming calendar year. One of the things that you may notice is that either through revalidations or just new enrollment, but MMAC, again, knowing that this new portal is still probably, a little less than 2 years out, what we did was we've continued to enhance the tools that we're currently using. And so what was our new provider portal has been incorporated into another portal that we use for our revalidations. And again, we did that for security purposes, but also it made it a little bit simpler for providers, whether they were new or revalidating. And then we've done some other, again, enhancements to the systems, and those were completed in mid-October. Some of it is seamless, and some of it's stuff that behind the scenes that you would not necessarily see, but it smoothed out our screening and credentialing processes there a little bit too. So that's kind of that in the enrollment world. Again, very excited about that. I'm going to make sure before I leave today that you have my you have my number and my email address. And again, I always say, if for some reason you're having an issue and you're not making the progress that you want to be making, you're welcome to contact me directly, and I'll get together with the appropriate team member, and we'll try and make sure that we get it resolved and get you back to doing whatever you need to do, what else you need to do as quickly as possible. So I think, again, the big thing that most folks are interested in is the audits, and obviously the dentists are just, one of 65 different provider types. I mentioned we're almost to 1,000 dental providers, but again, we have 73,000. So, again, we have limited bandwidth. And so I think the first thing that I want to make sure that everybody is really aware of is that we just don't do random audits anymore where we reach into the hat or whatever, and we say, okay, we haven't, we're going to go visit, dentist, whoever, and do an audit of them. There's just so many other competing demands that we just don't have the bandwidth or the interest in doing random anymore. So the first thing is everybody answers to somebody else, and MMAC. We have the state auditor's office looking over our shoulder. We have the Health and Human Services OIG looking over our shoulder. We've got the Centers for Medicare and Medicaid Services looking over our shoulder, and over the state Medicaid program. And so, we have to answer to them on a regular basis. Once every 3 years, CMS, the Centers for Medicare and Medicaid Services, they do what they call a perm audit of each state. It's a payment error rate measurement audit. And basically what they do for a state the size of Missouri is that they go in and they look at all of the claims that were submitted for a particular federal fiscal year. And then out of that, they will randomly select 2,500 claims across all provider types. So again, 2,500, 65 provider types. So obviously, the dental providers, or there's going to be a handful, maybe 20, 30, 40 of those claims are going to be dental claims that they're going to want to look at. So CMS has their own contractors that actually ask for those records and conducts the audits. And you will be seeing shortly, you'll be seeing a bulletin or a hot tip coming out from HealthNet, basically just notifying everything that CMS and its perm contractors, they'll be sending records requests directly to Missouri Medicaid providers for claims that were billed during a past state fiscal year. The regulations require that the Medicaid providers submit the requested information to the contractor, and it doesn't violate HIPAA. It's a permitted use under HIPAA, PHI type regulations or whatever. Patient authorizations are not required to respond to the request. CMS and its contractors totally comply with all Privacy Act requirements and PHI and stuff like that. So if by some chance you get a letter, and again, it will probably indicate that they're an authorized CMS contract or whatever, and they'll be asking for information for just one single claim, and they'll ask for the supporting documentation for that claim that you billed. So that's one of the types of audits that we where you might pop up. The other one is what we call a state audit sample. So within the state regulations, there's a statute that basically requires Missouri Medicaid Audit and Compliance to conduct this annual state audit sample. So again, we look across all of the claims in the claims universe for the year. We randomly, it's all done by computer, randomly select 425 claims from all 65 provider types. Again, it's a smaller number than the CMS, but out of the 425, there may be 10 dental providers that pop up in the state audit sample. So in those cases, again, MMAC will send a letter to the provider and indicate that we are auditing just one single claim, and we'll ask for the supporting documentation for that claim to come back. And if we don't get it, then there'll be a second or a third request. And if we don't get the information, then obviously we're going to recoup if there's no documentation provided, or or if it was billed improperly or whatever, then there could be a recoupment. But again, it's just one way that we might potentially reach out to you. HealthNet has a contractor that does all of the third-party liability. It's a company called Gainwell or HMS. And one of the areas that they look at is what we call commercial disallowance. So basically what this is it's a claim that was submitted to Medicaid, Missouri Medicaid or HealthNet when the participant had other medical insurance that should have been billed first. And so what HMS will do is they'll reach out to the provider. Sometimes there's just different reasons that you as a provider, you're supposed to be able to look in and see whether or not a Medicaid participant has other insurance before you bill Medicaid. We're supposed to be the payer of last resort. But if for some reason the information wasn't in the system properly, or there's just a variety of reasons why a commercial insurer, another health plan player, would deny a claim. Maybe they denied it and then you billed Medicaid, but we're not seeing that denial. Normally HMS can see all of that, but the bottom line is that they're looking at it. They're trying to determine, like I say, was it billed to the other insurance first? If it was denied, was it denied for a legitimate reason? Sometimes the first insurer, the commercial insurer, deny it, but they're just missing a piece of information. And if that information was resubmitted, then they would go ahead and pay the claim. But it doesn't get submitted, so it's a denial, and they just bill Medicaid. And we call those actionable denials. And so what we're trying to do is basically to get whatever piece of information, missing information, was needed by the other payer and get it to them so that they can pay that claim. But anyway, those are ongoing projects. We do it in dental, we do it in pharmacy, we do it in all kinds of different provider types. Again, HMS, this provider, is involved, but MMAC has we have some oversight over that. Dawn Paley from my staff kind of monitors what's going on in that area, and she will step in and help whenever she can if there's something that we can do to get that claim paid by the other insurer, and then get the Medicaid money returned to HealthNet. So those are kind of some different areas. Again, OIG, I mentioned them previously. So we just had a recent OIG audit where they were looking at the consumer directed services program in the health and community services area there, health and community based services. And what the OIG did was they audited 2 full years of consumer directed services claims, which actually came to over 11 million claims and nearly $1 billion. And what they did was they selected a statistically valid random sample of 150 claims out of that 11 million, and then we MMAC sent letters to those providers and asked them to provide us with the documentation. So that again, they haven't done that in the dental arena for a long time, and I don't think that the OIG is very concerned about dental providers. So I don't anticipate that they're going to do it. But there's always a possibility that, again, the Office of Inspector General, maybe they get a hot tip or something, a hotline complaint or something, and maybe they want to look at dental records. And so, we would obviously be working with them to get that information from the particular provider and get it to the OIG. But that's another source outside of MMAC. So really nowadays, again, talking about getting away from random. So what we're doing is we're using some very advanced data analytics. So all of the Medicaid claims for the last 3 or 4 years are obviously in the system, and we've got some pretty cutting edge you know, AI type analytic tools there that we use. And so what they can do with those tools is that, you know, if there are, you know, common fraud schemes that, and again, this is, we're really not too focused on the dental area, but you know, occasionally there is maybe, you know, if you were just to go out and Google, like, you know, the 5 most prevalent dental fraud schemes or whatever, right? Well, then we probably have algorithms that are monitoring those, you know, those types of things. And so running those analytics, they might identify, you know, a particular provider as an outlier, basically because of their billing pattern, or basically the way that they're billing for a specific procedure code or combination of codes. So in those cases, you know, again, we're going to see that. And so my team that does the dental audits, then they would have to make a decision based on what they're seeing there as to whether they want to do like a desk audit or whether they want to do an on-site audit. And again, I'm guessing that most of the people on this call, that if you haven't been visited in the past by Missouri Medicaid, then you may have maybe one of the managed care organizations or some other commercial payer that they have audited your records in some way or some other. And our processes are going to be very similar to that. So if we do a desk audit, again, the auditor is going to determine what the parameters of that audit are going to be, the beginning and end dates of the review period. And are they looking at just a specific procedure code, like maybe, you know, maybe it's a denture type audit, right? Or you know, maybe they're concentrating on you know, kids, you know, with their baby teeth or something along that line, just to kind of looking at specific procedure codes or specific groups of patients. And then basically they're going to identify their plan there, and then they're going to send you a letter telling you what we're doing and obviously our authority to do it. And then they're going to provide you with a list of Medicaid participants that they're wanting records on. And they'll either give the, you know, they'll give the some inclusive dates, or they'll provide specific dates. And then you'll get a turnaround time on that. So, and obviously, if you know, if you need more time, you know, my audit team, they've been told to be, you know, to be courteous with regards to, you know, legitimate requests for extensions on responding to you know, to our records request. Obviously during COVID, offices were short staffed. There's a variety of things going on, so we try and give you enough time. But if you need some additional time, so basically there'll be instructions in the letter as to how to get that how to get that information back to us. And the auditor's name will be on there, and there'll be contact information for if you have any questions or so on and so forth like that. But they're just pretty straightforward desk audits. Ask for the records, review the records, let you know afterwards as to, like I say, if everything looks good, I expect the auditor to send you something in a timely manner, letting you know that everything looks fine, no problems, thank you. If there's just some minor things like their educational type of things, we're gonna send you an education, what we call an education letter. We may ask for a corrective action plan, which is just to acknowledge the education and you know, tell us how you're going to basically prevent, you know, that particular you know, improper billing from occurring in the future. If for some reason we feel that there is you know, it was improperly billed and the money should be recouped, like maybe you billed for a higher something, you know, something that paid higher than what we would have actually should have billed for based on your documentation, then we might recoup the difference between the two. Or if there was no documentation, we might recoup on that or something like that. So again, there'd be a recoupment letter. There's instructions in there with regards to if you don't agree with it and you want to appeal it to the Administrative Hearing Commission, if there's a corrective action plan that's asked for on the side, if you do agree with it, and then, you know, depending on the amount, you know, we can if you want to pay it all at once, do you want to set up a repayment plan? Do you want us to recoup it from your previous, or from your future reimbursements, from Medicaid, or how you want to settle that. The last thing would basically be the on-site audits. And obviously we were doing a fair number of on-site audits before COVID. During the COVID thing, we kind of shut down the on-site audit thing. Now we've kind of stepped that back up. But I would just say that we have a pretty good balance between desk audits and on-site audits. What I can assure you is that if we're going to do an on-site audit, although we are legally allowed by Missouri regulations to do an on-site audit without prior notice, my unit will not do that. If we're going to come on site, we're going to reach out to you ahead of time, because again, we understand, busy dental offices, staffing, so on and so forth. We're going to try and find a time and date that are convenient for us to come in. There'll probably be 2 auditors that will come, and they'll bring their computer, their laptop, and a scanner. But if you have electronic health records, and you can put it on, you can provide it in electronic format. The scanner used to be for more of the paper records, right? Nowadays, with the electronic health records and stuff like that, a person within your organization should be able to pull down the requested records and basically provide them to us in some type of an electronic format, and such like that. Normally for the on-site audits, again, depending on the scope of the audit that they're doing, what they typically will do is they will, let's just say, for example, they want to look at 40 records, 40 patients. What they will do is they will give you a list of like 10 of the 40, and they'll send that ahead of time so that you can have those ready when they get there, and they can kind of start looking through those. And then when they arrive, they'll give you the other 30 names or whatever. And again, I'm just picking a number out of the air here, but they'll give you the other 30 names, and then ask you to go ahead and pull up those records while they're there that day. That's really pretty much it. After that, it follows it up. They take it back and do the same thing they would do with a desk audit. They're going to review all those records. If we have any questions, we're going to contact you. If it looks good, they're going to let you know that. If there's education, we're going to do that. Again, if there's a recoupment that needs to be done, then they're going to notify you about that. There's, again, same appeals process available, so on and so forth like that. So before I move on, Jessica, was there any questions? I know that I've talked here for, over 30 minutes here. Is there any questions to this point on what we've covered so far?
So I haven't seen any questions come through yet. Okay. If you have any questions and want to put those in the Q&A or chat real quick, we can try to address those while we're on the topic.
Okay. I just wanted to check there again. No problem there. So that, again, just kind of talking about all the different audit things. But again, I just kind of want to reemphasize that we're just not doing, the old random audit anymore there. We generally, if we're going to reach out to you and take up your time requesting this information, there's going to be a purpose. There's going to be a purpose behind that. And so we want to be respectful of what you're doing out there, all the good things you're doing for not only Medicaid participants, but all the citizens of the state there in your dental work there. Just a couple other areas I just want to talk about. Our investigations unit. So we have 10 investigators. So if for some reason an auditor was doing their audit and they felt that in the course of doing their audit that they felt that there was actual fraud, Medicaid fraud going on, then what they would do is they would go ahead and finish their review, but they would then refer it over to our investigations unit for them to, because at that point, most likely the investigators are going to want to go talk to Medicaid participants, or they may need to go interview individual, whether it's office staff or whether it's individual practitioners or whatever like that. I think it's probably been 4 or 5 years at least since we've had like a dental fraud case in Missouri. There for a while, it seemed like there maybe 2016, 2017, 2018, we had several dental cases. I recall a dental office down in the Springfield area that was pulling some stuff, and that went federal. We had a couple other providers that it was like dentures in nursing homes and stuff like that, where they were basically walking the halls and giving new dentures to pretty much everybody in the facility, so on and so forth. There was some unbundling where, like for dentures, if you normally everything is bundled in, like everything leading up to and then for like 6 months afterwards, as far as the routine visits or whatever, that is all supposed to be covered in the cost of that denture procedure code. And they were unbundling and charging us for individual office visits or refittings or things along that line. But again, it's probably been like, say, 4 or 5 years since we've had a dental fraud case that I'm aware of, which is a great thing there. But I just but we are prepared to do it if we need to. So anyway, I've got 10 investigators. I have 3 working out of an office in St. Charles, and the rest of them work here out of Jeff City, covering the whole state. We have about 70 fraud investigations open right now, and at any given time. The biggest area of fraud in the Missouri Medicaid program is in the home and community-based services, where you have basically relatives that are providing services to Medicaid participants, either through Department of Mental Health or through Department of Health and Senior Services. But there's a lot of fraud in that area, where basically the Medicaid participant and their attendants or their relatives are conspiring to game the system there. And so that's the most frequent type of provider that we look at. But we do have cases from different areas too. We sent out of the investigations that we closed last year, we sent 46 of them over to the Medicaid Fraud Control Unit at the Attorney General's office for prosecution. They currently, the Medicaid Fraud Control Unit, they currently have about 115 open investigations that were based on MMAC referrals over the last 2 or 3 years there. So, and then they work with the FBI and the OIG for Health and Human Services on cases that are referred to the feds. Otherwise, the cases are prosecuted they can be prosecuted through any county, or where the county where the provider is, or the state's position is that if there's a fraudulent claim submitted to HealthNet, that it was actually submitted in Cole County and it was paid from Cole County. So we do a lot of prosecutions out of Cole County. We have grand jury available to us for about a week every 6 months or so, and you'll see the Attorney General's office will probably indict maybe 30 different providers every 6 months or so, and a lot of those are MMAC cases. Let's see, suspensions and terminations. Again, just so you're aware, we terminated about 1,900 providers last year for a variety of reasons. That can range from the low end of the scale would be basically is that the individual's license expired, and maybe they knew about it, maybe they didn't, but their license expired or it was revoked, and so we have to terminate their Medicaid until that expired license either gets brought back into good standing by the professional board, or if it's a revocation that they or a suspension, that they come off of that, and the board, the professional board notifies us that they are good to practice, and then we'll work with them to get them reactivated. We imposed about 43 payment suspensions on HealthNet providers last year. A lot of times we use payment suspensions basically for to try and bring a provider back into compliance. So I mentioned revalidations earlier, but if we had a provider and they were due to revalidate their their enrollment 5 years, and we had sent them multiple notices and they hadn't responded to us, and they were coming up on their hard, what we call their hard, their hard deadline date. Then again, we've got people looking over our shoulders, OIG, CMS, everybody. They expect us to do something with that provider, not keep going on. And so I will send a letter to the provider basically telling them that we're going to have to turn off your Medicaid money until such time as you either tell us you don't want to be a provider anymore, or that you go ahead and successfully complete the revalidation process. So they're still active. They can still do their job. They can still submit claims, but the claims are just not going to pay until that approval is granted there. So I'm really Jessica, I've kind of run through all of the things that I wanted to kind of wanted to touch on today myself. I'm certainly open to any questions, or if I needed to, if folks were looking for, maybe I didn't talk about something that people are interested in or something.
Sure. Yeah, we'll use this time. If you have any questions or any other information, feel free to enter those in the Q&A box or the chat box. Let's see. We have Amanda Ferendorf here. I'm going to allow you to talk. Amanda, is there anything else that you would like to add on this topic? I know you provide a lot of the education for dental providers that help reduce the risk of these audit issues coming up. So anything else you would like to share on this topic?
Well, I mean, Dale covered a lot of it. I know that a lot of his staff, when they do find stuff, they refer them to education, and we work with providers on that side of things. So we just want our providers to know that we're available to educate them. If they have questions about billing or they're unsure about something, they can always reach out to us.
Great. Okay, so please enter any questions and concerns you have. We want to take time. We have about 15 minutes left, it looks like, to answer any questions you may have. I'm going to put some information in the chat box. Once I can find it. Okay, so I'm going to put the provider education email address in there.
Okay.
So if you do have any questions about billing or anything that you need clarified, this is the provider education contact information where they can help you with those. There is a dental education specialist, Lee Gerloff, who is available to answer any billing questions about dental. Any questions for MMAC? Any questions for Dale while we have him here? We really appreciate you taking the time out of your day to meet with us and share this information. Looks like Dale has also included, okay.
Yeah, I put my email address and my phone number that rings right to my desk in the chat there. If you need it there.
Okay, so there's direct contact information if you have any questions. This has been a lot of great information. We're seeing some thank yous in the Q&A box. Again, we really appreciate you taking the time to share this information with us. I know it can be a little bit intimidating for providers if they don't know what to expect from MMAC.
I think that's really what I mean, again, I appreciate the invite, and again, we're there, and obviously Amanda there too, right? I mean, if you have billing questions, if your office manager has billing questions, if there's something about checking eligibility, or whatever, I mean, there's different numbers that are available to help folks. And again, audit and compliance sounds a little onerous sometimes, and but we want to help people as much as and we're not, I guess my thing to all of my people is I just want to be fair but firm. That's always been my mantra basically since I took over as the director, right? So if there's a good excuse as to why something happened or whatever, then we're going to we're going to acknowledge that, but we also want to be firm with regards to, what are the standard expectations, for that particular provider type. And so, if what somebody has done is, again, there, like I say, there's a total lack of appropriate documentation, or it was just, improperly billed to the point where we got to take money back or something, then I need to be firm about that. And I got to let the appeal process, again, there's an administrative hearing commissioner that's willing to hear people out. And if he feels that there's a compelling reason to change what we did, then he'll do that. But again, I'm not looking to make everybody's life more difficult. I appreciate being invited to your conference there that was in Jefferson City this year. I appreciate the invite to the to this lunchtime webinar. Appreciate people taking time out of their day to to tune in there a little bit. And if I can do anything, or if my team can do anything, then we're we want to be partners in that area.
Absolutely. Thank you for that. And yeah, I'm always reminding providers that Medicaid is state dollars, and we have to be responsible for that. And that's what MMAC is here for, to make sure that we are being responsible with those funds. We have put a link to the survey for this session in the chat box. Again, we really appreciate your feedback on those surveys. It helps us know if this was helpful, if there's other information you need, how we can make these more beneficial for you. I'm also including my email address. If you have any questions about credentialing or getting enrolled with MMAC, I am here to help providers with that and help with the process. Let's see, I'm also going to put one more link. All these links will also be in the email that comes out after the webinar with that post-session survey. The link I just shared is where this recording will be posted. So this is a link to the Missouri Coalition for Oral Health website, all of our Missouri Medicaid resources. That is where you'll be able to find this recording following today's webinar. Okay. Any other questions? And we've had a quiet group on this call. I guess you must have covered everything so well, Dale, that they don't have any questions. This is your opportunity. We do have a few minutes left. If you have anything you'd like to discuss or hear more about, please let us know.
Yeah. If you do get any after the webinar, just shoot them to Amanda and myself, and we'll make sure that somebody gets back. Sometimes folks are shy there. They don't want to ask in front of everybody else. But I think that again, we're happy to do any follow up if we need to.
Absolutely. And as Gary mentioned in the chat, I think everyone's already got Thanksgiving on their mind, with it being Friday before Thanksgiving. Yep. So yes, and definitely, if providers have any specific questions or specific things they want to discuss, please feel free to reach out to us afterwards, and we're happy to take the time to discuss those with you. But other than that, I am not seeing any questions or anything in the chat. So I suppose we will go ahead and close out today's webinar. Happy Friday to everyone. We're giving you 10 minutes of your day back. Again, we appreciate everyone being here. Dale, we appreciate you being here. Amanda, thank you for taking the time out of your day to share this information with providers and being a resource for them. Providers, please feel free to follow up with any of us if you need. Share this information with your colleagues. We appreciate you helping us get the information out there to help debunk some of these myths, especially when it comes to the audit process. So thank you again, and everyone have a wonderful Friday and a wonderful Thanksgiving.
Thank you.
Thank you.
Thank you.
I think that went very well.
I agree. You shared a lot of wonderful information.
Yeah, and it's good, concrete, factual stuff, and it's bound to be helpful for people to hear that.
Yes, I agree.
I mean, audits are scary.
They can be. Yes, hopefully this will be helpful. Let's stop.